So what will we be covering tonight? Why do we need a best practice framework and how did we get to this point? We're going to briefly go through the framework itself as well as some of the key documents such as the decision-making guide that's used in conjunction with the framework and its appendices. We've got other associated tools and resources, and importantly, we'll conclude with a discussion about the next steps for supporting implementation of the framework. As part of this, we would love to hear from you about what you're doing, as well as what PRECI can do to support you. As well as these webinars, we will be going back out to targeted groups involved in the development of the framework through November and December to get their specific input into the implementation of the framework. Also, please note that the term intervention has continued to be used in the framework, although we consulted and surveyed the field in relation to the use of this term as both the name of the sector and the way we work with children and their families and others. The results were inconclusive. So just be assured that this important. So please use the chat function for comments and questions. Okay, let's get going. So I am going to very briefly talk about the project. So the project was commissioned by the Department of Social Services with the NDIS in fulfilment of one of the early childhood targeted action plans, Targeted Action Plan 2.4 within Australia's Disability Strategy 2021 to 2031. The purpose of the Targeted Action Plan was to review guidance for best practice in early childhood intervention and prepare a best practice framework that reflected current research and evidence. The second part was to strengthen the capability and capacity of key services and systems to support parents and carers to make informed decisions about their child. The challenge currently facing this area in Australia is that the systems, the policies, and many of the practices intended to support young children with developmental concerns, delay, or disability and their families do not align with the evidence for best practice approaches. So best practice is currently not standard practice. So we need to make best practice usual practice in order for children and families to achieve the outcomes they should expect from being involved in early childhood intervention. So just briefly, what's contributed to the challenges? The unintended consequences of the implementation of the NDIS and the associated policy and pricing. This has led to an increasing number of siloed services delivered in clinical settings. Okay, yep, somebody tried to mute me. Did you hear that last bit, Tim?
No.
Okay, so let me just see what's contributed to the challenges. So the unintended consequences of the implementation of the NDIS and associated policy and pricing. So this has led to an increasing number of siloed services delivered in clinical settings focused on the individual child and their impairments. There's lack of recognition and support for families and their role in supporting their child's learning, development and participation, given our knowledge that children thrive when their families are well supported. A lack of dependable information to enable parents and carers to make informed decisions about the services and supports that will deliver the best outcomes for their child and family. There's a complicated and difficult to navigate system. Workforce shortages, especially of professionals who understand and apply high quality services and supports. And the best practice guidelines that we developed in 2016 didn't provide sufficient practice guidance to support effective implementation. So in summary, it was time to update the old guidelines. The NDIS review had occurred with the recommendation of foundational supports, and we now have the Thriving Kids initiative. We needed a framework to support the new initiatives as well as the required systemic changes. So how did we get here? So the consortium was developed, and I've already mentioned who was on the consortium, and this was really important to have the breadth of expertise, experience and connection across Australia and internationally. Research evidence was reviewed, so the three blue boxes on the left, for policy, research and practice underpinning early childhood intervention, both nationally and internationally. On the right, the coloured boxes, we engaged in extensive consultation to gather diverse experiences and perspectives on early childhood intervention and support. The findings were then synthesised, so we brought together what was learned from the literature reviews and the consultations to identify what we called candidate elements and content for the framework, from which the actual framework was derived, and we took the draft framework back out to consultation. Then finally, we put together the framework and the tools and resources to support its use. Again, we did this through the use of iterative consultations, and I know many of you were involved in those, and we greatly appreciated your input. We also worked closely with experts through an advisory group from Australia and overseas at every stage. So that's what we've done. So Tim, it's now over to you.
Thank you. So I'm going to talk about what's in the framework and talk about the first 4 dot points there, the vision, aims and outcomes that we came up with, the core and key principles, theory of change and the decision-making guide, and background briefs. In addition to those, we will hear about the practice guides, the looks like and doesn't look like guides, videos and podcasts for each of the key principles, guides for families, early childhood educators, referrers and policymakers. And I haven't actually listed all the materials that we produced. I think in the end, we submitted to the department over 100 pieces of resources in terms of reports and so on. So this is a very comprehensive piece of work.
Let's take you around.
May I have the next slide, please? So vision and aims, we had to begin with this, and we started with the vision and aims that were for all kids, because our argument was that the vision and aims should be the same. And for all children, the vision is that all children in Australia thrive in their early years, and that comes from the National Early Years Strategy. Children with developmental concerns, etc., and their families do have the same aims and outcomes as all others. But since families are fundamental to the well-being and development of young children, all kids, but particularly children with developmental concerns, delay or disability, the aim for them is, in the box, all children with developmental concerns, delay or disability and their families thrive in their early years. So that's our vision statement for the framework. And the statement of aims and outcomes are complemented in some of the associated papers by accounts of the conditions that families and children and families need to achieve those aims. The next slide. So what were the aims? We had identified aims and outcomes sitting underneath that grand vision. And we identified aims and outcomes for children, parents and carers, communities, and for services. So for kids, to build on children's strengths and interests, to enhance learning, development, and meaningful participation in everyday activities. In the full document, full framework, there's more detail sitting in behind that. For parents, carers, and families, our aim was to acknowledge and respect family and community cultures and to strengthen knowledge, skills, and confidence to support child and family quality of life. We had aims that we didn't include in our previous set of principles for communities. They are important from the point of view of supporting families, to enable families to be able to support kids, etc. So the aim for communities was to understand child development and well-being, and to help create safe, welcoming, inclusive, and connected communities. So that now becomes something that early childhood intervention practitioners and others need to take into consideration. Finally, we had aims and outcomes for service agencies and for practitioners. And the aim was to contribute to the development of a collaborative and integrated network of holistic supports for children, parents, carers, families, and communities, and to build supportive networks with colleagues. So that now we're taking on board the notion that we need to be working collaboratively with each other and with other services in order to provide holistic support for children and families. Next slide. So on the right, this is the framework at a glance with principles and practices. And as you can see, there are 4 universal principles that underpin, and they are rights-based, rights of children particularly, relationship-based, recognising that relationships underpin every aspect of early childhood intervention support, strength-based, recognising that all the work that we do must be built upon recognising children and family strengths, and ecologically based, the notion that we recognise that how families function depends upon the environment in which they live and the resources that they have. Similarly, how children function depends upon what the parents are able to provide them with. So we've also got 10 key principles sitting in behind that, and we've grouped them into 5 clusters. There's a child and family-centered cluster. So child-centered, we really didn't have in the principles before. Family-centered, obviously, this has been a guiding principle for us for the past 35 years. Culture and diversity affirming, but also cultural safety, which is specific to our work with Aboriginal and Torres Strait Islander communities. We have a connection and collaboration cluster, which is teamwork and being community focused, thinking about the role that community plays in supporting families and children. We have an inclusion cluster that is participation, encouraging participation on the part of children and families in everyday activities. And we have everyday settings. That is the notion that that children learn best in the settings in which they spend their time, and that we should also work in those settings. And finally, we have outcomes and evidence, the fact that anything we do should be evidence informed, and that all our services should be outcomes focused. That is, they should start with the end in mind. Next slide, please. So we have a theory of change. This is the short version of it. There is a paper with a longer version. And what this theory of change does is it explains how using the framework principles and practices leads to better outcomes for children and families. So it describes who needs to be involved. That's along the bottom. So it's got ECI practitioners, parents, carers, and families. They are involved in the delivery of this framework. Early childhood education and care services and schools, other child and family services, parent support programs and the like, and government agencies. All of these have a role to play in ensuring that this framework gets implemented. The next line up is what we need to do. So for each of those groups, it describes what action they need to take. The line above that is what impact we anticipate those actions will have. And the line above that shows what the outcomes will be for children, for families and communities. And all of those contribute at the top to the ultimate aim that all children with developmental concerns, delay and disabilities and their families thrive in the early years. Next slide. Then we have what is possibly the most important document in this is a decision-making guide, which is a stepped procedure to be used by practitioners and families in reaching the important decisions about what goals to focus on, what strategies to use to achieve those goals, who should be on the early childhood intervention or support team, what form support should take, where services should be provided, and how intensive they should be. These are all classic questions that are faced by parents and practitioners, particularly difficult and tricky early in the sequence, early in when they're just beginning. So the stepped procedure, and there are 2 steps at each of these 6 stages. There's initial contact and engagement, and then there's gathering information and identifying needs, and then developing goals and strategies. You'll notice that we're halfway through it and we still haven't got to the business of determining what service to provide. This is an outcomes-focused approach. Develop goals, and then you can identify strategies. And then there's the implementation, where we're building the competencies of parents and other caregivers to be able to provide the child with the support and experiences they need. Then there's the monitoring and evaluation, finally review and transition. And you'll notice that there are those feedback loops. So at any point along this sequence, if you come to a point where you say, well, that didn't work, you go back. So the framework shows you how to loop back to an earlier stage, revisit, did we get the goals right? Did we get the strategy right? Have we succeeded in building your ability to do it, etc.? So an important contribution. Sitting behind that, on the next slide, are some resources. There is how often, how much, and for how long, an evidence brief. This addresses the key issue of how intensive services should be. And you'll know that that is a challenge in the current system. Then there's the teamwork one, a practice brief on the vexed question of what is a key worker and what sort of teams do people need. Finally, there's a measurement overview, which has got a set of outcome measures, guidance for measures on a whole series of things. Now, I think that's my lot, is it not, Denise? And I hand over to Kerry.
Or to Susanna.
Yeah, Susanna, I think.
Susanna, apologies. Teamwork fell apart.
All right, thank you, Tim. We will now move on to another important set of resources of the framework. The practice guidance and the looks like, doesn't look like documents. The practice guidance does represent each of the 14 principles which Tim highlighted earlier, and are presented, or we developed them as 14 different pieces, so 14 different documents. Each of these practice guidance documents include an overview of the principle, the rationale behind it, and a list of practices related to each principle. A distinctive feature of these practice guidance documents is the specification of outcomes sought when implementing these practices. We've never had that before in the previous guidelines. You will see this in the practice guidance under the heading, we know this is working well when children, parents, and carers or families are, and then we have ellipses, followed by a series of statements representing outcomes for children, families, and at times, practitioners. And finally, within the practice guidance, we have various elements of the framework relevant to that specific practice.
Oopsie.
Next, we're still in the looks like, doesn't look like. The looks like, doesn't look like tools also represent each of the principles, and they provide an overview of the practice when it's implemented effectively and when it's not. The main aim of these tools is to demonstrate practices that are, well, practical, representing examples of everyday practice, several of which were drawn from the consultations we conducted with a range of professionals and from our team's experiences supporting children and families. Next slide, please. Among the other resources that we develop, we have videos representing international and national perspectives and expertise related to each of the principles. Similarly, we developed a series of podcasts where we hear from families and professionals discussing how each of these principles is reflected in their experience. I highly recommend these. They're just so nice and full of wonderful tips and experience from parents and practitioners. The next slide it makes reference to measurement tools and guides that Tim also mentioned earlier. So we developed a suite of resources to support this. These are to support the implementation of the framework, and they provide guidance about selecting outcome measures and information about the tools that are appropriate for children, parents, carers, and families, and service providers. In addition to the outcome measures guide, these resources include two other documents. The measurement overview, which is a document to support practitioners to understand measures in general and to support choosing the appropriate outcome measure. And the second one refers to the development of a suite of resources to support outcome measurement. And it explains how the process of choosing the outcome measures was undertaken. Next slide, please. Other tools and resources also include video developed for families, which is based on research about what works well for families and what families told us as well, what worked well for them. And then we have two other videos that were developed by SNAKE in conjunction with Aboriginal and Torres Strait Islander communities in Queensland and New South Wales. These videos are for families and practitioners supporting these communities. Next slide, please. So this is another interesting addition to the framework, which refers to, and is an addition and a new addition. The framework is not just for ECI practitioners and families. It has also been designed with a wide group of users in mind. So the framework includes, if you see on the left, includes guidance for different groups, such as early childhood educators, referrers to early childhood interventions, such as maternal and child health, GPs, and so forth and so on, as well as policymakers, the one on your right. These guidelines not only provide a description of the framework, but also target specific implications of the framework for practitioners in each of these groups, professionals in each of these groups. These resources also contain a section on how professionals in these groups would know when the framework principles are working well with the children and families they support. I think that's about it in terms of the tools, practice guidance, and the actual translational tools.